This is a straightforward map. If you happen to find a murmur, take a history and examination. If it fits either chest pain, heart failure or arrhythmia, use our relevant cardiology pathway. If the examination is normal, then perform an ECG. If it's abnormal, again use the relevant cardiology pathway. But if it's normal, just book an echocardiogram. If this actually confirms the presence of valvular heart disease, if it's normal or only mildly abnormal, you will get an interpretation from the cardiac physiologist summarizing the report and the suggested management plan. If, however, the valvular heart disease is or moderate or severe, you will be advised to refer to cardiology, who will follow them up. If they are already diagnosed and have seen cardiology before but developed new symptoms, then please re-refer. Thanks for listening.